In this video, I'm going to cover the rest of the Bunya viruses. I discussed most of them in a separate video. These viruses that we're going to talk about here are all related to either the Hanta or Hantan viruses. And in the other video, I covered the Bunya viruses that lead to encephalitis. So the California encephalitis virus, La Crosse virus, and Jamestown Canyon virus. We're not going to talk about those in this video. I talk about them in the encephalitis virus video. So we're going to talk about these up here. So when we think about the Bunya virus family, half of them are transmitted by arthropods, and those were covered in the other video. The other half, which is what we're going to talk about here, are transmitted by inhalation of dried rodent excrement, i.e. you inhale dried mouse urine. These are enveloped just like the arthropod-borne viruses in this family and ambisynth single-stranded RNA with a 3-part genome. Okay, so we're going to start with Korean hemorrhagic fever. This is Hantan virus. So these are Hantaviruses, and this is called Hantan virus. The reservoir for this one is rodents, because remember, that's where we're actually going to get it. And it doesn't really have a vector. It's just that the virus is excreted from the rodent in its urine. And then as the urine dries, we are able to aerosolize it and turn it into something that we can inhale. So that is kind of the method by which this occurs. So what happens is the inhaled rodent excrement basically leads to viremia in the patient. And that viremia actually leads to the antibody formation. And the antibody formation is actually kind of dangerous. So it's the antibody formation that actually leads to kind of an immune complex-like disorder. You get capillary leak, edema, shock, and basically just general hemorrhage as a result of this like deposition of antibodies and their complexes along the endothelium. And specifically, whenever you think of an antibody complex disorder, things like hematuria, renal failure, affecting the kidneys is pretty common because the kidneys are a site of filtration. So there's spaces there that are really tight, and once you get this antibody complex basically being deposited in the kidneys, then you get increased inflammation, which can lead to hemorrhage. This one can be very deadly. It's got a pretty high fatality rate, and it's not necessarily mediated by the virus, just the effect that the virus has on our immune response. Thankfully, we don't see this one too often in the US. Typically, we see it in Korea. That's why it's called Korean hemorrhagic fever. So the other two organisms we're going to talk about right now are also hantaviruses. This one is Hantan virus as well. And this one actually causes what's known as hantavirus pulmonary syndrome, or HPS. So instead of a renal tract, you're actually going to get a pulmonary tract. So this one is actually found in deer mice. Deer mice is a specific species of mice that are basically known for being incredibly agile. So they're just a certain variety of mice that we typically find in the Western US, and it is their droppings is how we actually acquire the disease. This one is actually referred to as an emerging viral disease. Thankfully, it's still relatively rare here. You can get HPS with either what's Hantavirus in the in Asia and in Eastern Europe. In the US, it's a slightly different virus known as sin nombre virus. So this is a very nasty case. Incubation time is not really known. However, it appears that symptoms develop between 1 and 8 weeks after exposure. So anywhere from 1 to 8 week incubation is associated with this particular viral syndrome. So it's a pretty nasty one. We only get about 20 to 40 cases in the US per year. And again, in the US, we're talking more sin nombre than Hanten. Early symptoms will include that undifferentiated fever. So fatigue, fever, muscle aches, dizziness, chills, abdominal pain, nausea, vomiting, diarrhea, things that we associated with that. So basically a nasty undifferentiated fever plus some gastrointestinal symptoms. Then about 4 to 10 days later, after the initial phase of the illness begins, the patient starts developing pulmonary symptoms. So at about 4 to 10 days later, you're going to start seeing dyspnea, as well as things like a cough that's basically caused by this interstitial pulmonary edema. And it's the pulmonary edema that's really problematic in these patients. Pulmonary edema is what leads to death in about 50% of cases. The lung edema is practically irreversible. There's nothing we can do about it. And the patient requires significant respiratory support. There is no renal involvement like we see with Korean hemorrhagic syndrome. This is actually all pulmonary. And one survivor of this virus said that he felt like he was breathing with a tight band around his chest and a pillow held over his face. So that's how significant the difficulty breathing can feel. Like many of the Bunya viruses, there's no treatment. There is no vaccine. Really all we can do is supportive care. And in this case, you're really going to worry about the respiratory support. That's the most significant thing. This sin nombre virus, the way it got its name, so if you speak Spanish, sin nombre basically means without name. Originally, this virus was known as the Four Corners virus. It's named after the area of the United States where 4 states actually meet. And if you happen to stand in all 4 corners, you can be in 4 states at once. So that's kind of neat. But when they named it the Four Corners virus, the basically tourism board was like, you can't name it that. Like, people will stop coming to us, and we're an important U.S. landmark. You can't do that. So the nomenclature committee said, well, you know what? The guy who originally got it lived in this tiny canyon called Muerto Canyon. So they named it Muerto Canyon virus. That was the second name this virus had. Well, it turns out that Muerto Canyon has about 6 houses in it, and the people who lived there really did not like that they had a deadly disease named after them and thought it was going to affect their property value. So they also basically complained loudly enough to the nomenclature committee that they were like, okay, fine, we will rename this virus again. So they needed to think of a virus name that wouldn't offend everybody. So they basically called it the virus without a name. So they called it sin nombre virus. This graphic here is actually something that the CDC has been collecting on sin nombre virus, or hantavirus pulmonary infection. They've been keeping track of the cases since about 1993, and currently we've only had about 36 states have had cases. So it's not rampant everywhere. Mainly you only see it where the deer mouse is, because remember, that's its reservoir. So since 1993, we've only had 728 cases in the United States. But this is on the rise, and actually this number, like kind of the amount of cases we're having per year, is steadily going up since about 2010. So we're seeing more of it, just to it's a virus to keep aware of. There is one other virus. I normally don't teach it, but there actually was a bit of an outbreak in 2017, this year, the year I'm recording this video. If it sticks around, then I will keep this in. If not, I'll probably remove it at some point. It's unlikely that you'll see this one on step 1. Frankly, it's unlikely you'd see any of these on step 1, I would doubt. But this is called Sol virus, and there is a current outbreak of it. 17 people in 7 states across the United States currently have had this. So what happened was that the CDC traced some shipments of rats which were infected with Sol virus from Korea. So they figured out that it came from a particular rat breeder over in Korea. State and local departments of health are reaching out to breeders and owners of rats for suspected or confirmed facilities to test rats. So what happens with sole virus is that people become infected after coming in contact with the urine droppings, just like the other bunyias. You can also get this one from rat bites. So this is kind of a difference. And because most of the people who have contracted this happen to be either rat breeders or distributors or pet shop owners, rat bites are certainly a method for transmission. This one is actually really similar to Korean hemorrhagic fever virus. In fact, it's almost the exact same virus. So you're just going to get hemorrhagic fever with that renal syndrome that we discussed for that one. And again, that one's more likely to be due to the immune complexes than it is to the virus itself. The good news is that for sole virus, we actually have a treatment. So you can provide supportive care, certainly, but ribavirin has actually been shown to be effective against sole virus. And that's pretty much the end of the bunya viruses.